Welcome, everyone. I'd like to welcome you to our webinar and panel discussion. My name is Michelle Anschutz. I'm the Chief Commercial Officer for Ondine Biomedical. Today, we're here for a panel discussion to talk with two enterprising physicians who are preparing their practices to safely and quickly draw patients back into their surgical practices during these unprecedented times of COVID-19. This is a topic that is of top concerns for many people, patients, staff, and surgeons, as we're all trying to get back to the new normal while not sacrificing the safety for all those involved. Today, we'll hear from Dr. Travis Marion, who's an orthopedic surgeon at Thunder Bay Regional Health Science Center and assistant professor with the Northern Ontario School of Medicine. His specialties include orthopedic trauma, spine, and arthroplasty, and is an avid clinical researcher in this space, having received several international awards. Good afternoon, Dr. Marion.
Thank you very much. Thank you for that warm welcome.
Dr. Jack Kolenda, he's a board-certified otolaryngologist who specializes in craniofacial, facial plastics, and reconstructive surgery of the head and neck. Dr. Kolenda owns Verso Surgery Center in Oakville, Ontario. Good afternoon.
Thanks for the warm welcome, Michelle.
Both of today's panelists have reported they have no disclosures or conflicts of interest with regards to Ondine Biomedical. The solution today that we will be talking about is Steriwave and is currently approved by Health Canada, and we have recently received CE approval. We have an active application with the US FDA, and it is not currently available for sale in the United States. Just a little bit of some mechanics. We expect this webinar and discussion to take about 45 minutes. We will have a discussion with the surgeons for the first half of the session, and then our VP of Clinical and Medical Affairs, Jason Hickok, will walk through our technology at the end of this seminar. We'll have two opportunities for Q&A, one after we have our panel discussion with the surgeons, and then they will drop off, and then Jason will stay on, and then have a Q&A about the technology. So if you have any questions, there is a Q&A tab in the app. Please submit them, and we'll take them as we can at the end of the session. All right, let's get started. Well, thank you very much for being here. We very much appreciate your time. We know that you are still performing surgeries now, not as many as you would like to be doing right now, but you're still performing special cases and urgent cases on the patients today. So we appreciate you spending the time today. So the first question, I'm going to pose it to Dr. Marion, and then I'll have Dr. Kolenda answer as well. Many clinicians and business owners are preparing to reopen their clinics and surgery centers. Are you sensing any apprehension or concern from patients about booking appointments, consults, or procedures? Dr. Marion.
Yes, thank you for the question. As expected, I'm currently seeing mixed results. I'm certainly appreciating the patients that have lived with disability for quite some time, and they're ready and willing to undergo the surgical procedure that they've consented for and has been discussed in the past. However, there's certainly a degree of apprehension amongst both patients and staff at our facility with respect to COVID-19 and the impact the pandemic will have on the ability to deliver care while trying to maintain safety for everybody.
Thank you, Dr. Marion. Dr. Kolenda?
So there are two types of patients. The first type of patient was the patient that was supposed to undergo surgery, was given the date for surgery, and there's been a cancellation. So those patients are quite frustrated that their surgeries have been pushed off, and they just want to have an answer as to when they're going to be able to have it done. The second set of patients are those patients that we've been seeing on an urgent basis because of possible tumors, cancers. And again, those patients are also displaying quite a bit of anxiety. In terms of staff, I find that given that I've already been working in the hospitals and operating actively, be it on non-COVID or COVID patients, I think the hospitals have made great adjustments in terms of providing the PPEs. And so things have kind of normalized for most staff. But going back to patients, it's the when is it going to happen? When will you be able to do my surgery? That's the biggest issue right now that my staff and myself are facing.
So you're most, I mean, in a situation where you want to get back to normal, you have people that are apprehensive and concerned, and rightfully so. What are you doing to alleviate those concerns, and how are you addressing those? Dr. Marion?
Yeah, right now, we have undergone a number of institutional changes, both in the hospital as well as our own clinics. This has basically been a systematic and layered approach. So physical distancing, staggering patients, prolonging clinic hours at this stage. We're abiding by the PPE recommendations as of right now. And of course, we're trying to promote testing. So all of our preoperative patients, when timing can allow for it, we'll have the rapid test done in an institution. But I really see the nasal photodisinfection as being potentially the next step for this, or serving as an adjunct to what was already in place.
Thank you, Dr. Marion. Dr. Kolenda?
So just to add to that, I mean, there are two spaces. There's the hospital space, and I think that all the appropriate changes have occurred moving forward. And then there's the clinic space. So in our facility, I have a surgery center. We're not doing any active surgeries, but we are seeing patients, not for cosmetic purposes, but for urgent tumor cases. And essentially, we've instituted a number of things. The social distancing is very important. And if you have a large clinic space, that potentially is easier to accomplish. And we do that by essentially having patients come in, not waiting in the waiting room, and going into their designated rooms. But even before they get that, there are several things that we're going to do. And again, it comes down to social distancing. So we're using our EMR to remotely have check-ins, so the patients don't have to be sitting there in the waiting room filling out the forms. We do a pre-screening call looking for the appropriate symptoms. When patients come in, we do take their temperature, although that's controversial whether or not we should be doing that or not. All my staff is wearing PPEs, and I think masks are essentially paramount at this point, and we encourage our patients to wear masks. And when they come in, there's such a shortage of that available to regular people that they're actually asking us whether or not we can provide them with masks. And thus far, we've been having difficulties with that. And then once they get in the rooms, it's interesting because a lot of people, especially initially when they're coming in, people wouldn't even want to sit down on the chair because they're afraid that they could catch the virus. And so we've promoted on our Instagram the different techniques that we're using to clean in between patients. We are investing in UVC light, which is another form of sterilization. And finally, when they're going for the surgery, photodisinfection, which has been part of our pre-op preparation for surgeries, that's going to be mandatory, given that we know that COVID, starts off in the nasal passages.
Great, thank you. I'll go to Dr. Marion. How did you first decide to implement photodisinfection? I know you had some great conversations with Ken up in Thunder Bay. Do you want to give us an understanding of how you heard about it and why you made a decision to bring it into your practice?
Absolutely. I first encountered it actually at the University of British Columbia when I was a fellow there. This study was being conducted on elective patients preoperatively. At that point, I wasn't too aware of the science behind it, the outcomes, and it was through my networking with the group there and being present at a number of national meetings where the literature revealed essentially the benefits of it in reducing surgical site infections from an arthroplasty standpoint and postoperative spine standpoint. As an orthopedic surgeon, this is incredibly important to me. And so my group was already looking to invest in this product for the benefit of our patients in hopes of reducing the risk of surgical site infections. With the COVID-19 pandemic coming and the viral physiology replicating in the nares and the science that this is backed by, we saw this as an opportunity to invest in it sooner than we anticipated.
So how are you using it today in your practice, Dr. Marion?
So
You
currently we
you just
have,
brought it
so currently we are using it as prophylaxis for ourselves, recognizing that we don't have any confirmed clinical trials. However, based on the science thus far that I'm sure we'll be elaborating on later. Right now, surgeons that are on call are using it every 3 to 5 days as they see fit. We are fortunate, being in Thunder Bay, that we're somewhat isolated, and therefore we do not have a large impact of COVID-19.
right.
However, we are looking to implement this as a mandatory, or at least to be standard of care. It'll be difficult to institute this as a mandatory technology immediately. However, we're going to be offering it to all of our patients electively preoperatively.
Fantastic. Dr. Kolenda, how did you, why did you decide to implement photodisinfection, and how are you using it today in your practice?
So, my story is a little bit different. I've been using this for over a year now. And the reason why I got this is because I came into contact with a patient who developed C. aureus infection. And there was nothing we could do for this patient. There was no standard medical therapy that could essentially change the course of what happened to this patient. So then I looked into the literature and what's available. And, you Google, and Ondine came up. And so I did the research on Ondine. And that's when we started talking about, what is it that it's doing? Because we know that there's an, higher antibiotic resistance phenomenon going on. And pre-COVID-19, everybody was actually talking about in the news about C. aureus. That has kind of died off. But bottom line is, it's an alternative way of treatment, given that we don't have all the resources for perioperative infection treatment. And this is just another way. It's a new technology. Well, I mean, it's fairly new technology, but the premise has been around for a long time, that this allows for treatment of resistant microbes, and it doesn't develop any resistance to this treatment. And so for my private patients, i.e. the cosmetic patients and my OHIP patients, reduction in perioperative infections is paramount.
Right. So because you have a unique situation and you've been using it for quite some time, what has been the uptake on your patients? Have they been, are you selling these treatment to your patients? How are you presenting it? Are you getting any concerns? What is the uptake of the technology in your practice?
So I have a mixed practice. I have a private paid practice, and then I have the standard OHIP practice. And so during the discussions, when we're booking patients for surgeries and we discuss the consent, obviously infection, the risk of infection comes up. And that's when we get into the discussion, what's available. And we talk about what is the standard treatment that's offered across the country. And then we talk about how photodisinfection is another source of protection for these patients. For my private patients, that treatment is included as part of what they're paying for their procedures. And for OHIP patients, it is presented as being an option. And I liken it to being a prescription for an antibiotic. Just like you will buy your own antibiotics for the postoperative period, here's an option. It's not a pill. It's a technology that you can actually use to reduce your risk of infection. And it's up to them whether they want to pursue that or not.
Right. So I have to ask the magic question: have you had any infections of the patients that have received our treatment? Have you had any infections?
So thus far, no. We have not, since we've instituted this, and I do a lot of rhinoplasties as well. And so this was key for me as well, to reduce the rate of infection. Given that you have a lot of resistant bacteria and fungi living in your nose to begin with. And since we've instituted it, nothing, zero, no perioperative infection whatsoever.
Fantastic. That's what I like to hear, Dr. Kolenda.
Yep. Well, that's why I invested in your technology.
That's great.
I believe it.
And we believe in it as well. And we know that there's a lot more additional applications that we're going to have coming down the road. And I know you're helping us with a few of those. So thank you for that. Obviously this is part of your practice, so this next question will go for Dr. Marion. You're bringing this in now because of COVID. You want some additional measures for your staff. And is this going to be something that you're going to maintain in your practice? Do you see it carrying over into your hospital system as well, in your surgeries? Can you talk a little bit about that?
Yeah, so right now we're ironing out the details as to where and when it'll be applied, in which institution. Much like Dr. Kolenda's practice, the goal was initially to provide this to elective patients prior to the COVID pandemic. And so that's how we will plan to roll it out. And again, liken it to an additional adjunct in terms of fighting the risk of infections. Initially, we will be passing that cost on to patients, at least until we've recouped the investment made. However, we are actively working with our institution in trying to show the benefit of this in hopes of making this the standard of care and have it provided from the institution itself.
Fantastic. Dr. Kolenda, I have a question that has come in. You've instituted and brought it into your facility. How has it been as far as training, an impact to your workflow? Can you comment on that? I know that you've had you have the benefit of having an infection control specialist in your operation. Yeah. Can you talk about how that impacted bringing it into your organization there?
Yeah. So first of all, my infectious disease nurse, if you know anything about these infectious disease nurses, is that they're very practical and they want to have evidence behind what we're going to institute. And she was completely on board with this. She was actually very excited to bring it on. But whether you have an infectious disease nurse on staff or not, the implementation process was really easy. Your company provided all the training when we received the unit. All my nurses were trained how essentially to provide the service. And it's not something I can do the service, and occasionally I do it, but essentially this is a service that's provided by my nurses. And there's no issues in terms of flow. If we're doing cosmetic procedures in our clinic, the patients come in and essentially the first thing they get done is the on-dyeing treatment, and then we move on with the complete process. For OHIP patients, because they're being done at another institution, they will come in on the day of surgery, and we have somebody coming in the morning of early, so they can actually have their treatment in the clinic, and then they can actually make their way to the hospital. So it can become an issue, especially with the first case, if they're trying to get that done, but we've been able to work around it. And I have a number of nurses that work in my clinic, and so they take turns when it's necessary to come in early in the morning. They don't love it, but they will do it. They have to do it.
Okay. Thank you for that. Dr. Marion, have you had any experience? I know you've been personally trained and used the product as well. Do you foresee any issues or things that we would need to be concerned about if somebody was adopting this for their facility?
Certainly not with respect to ease of use. As Dr. Kolenda mentioned, it's a very simple machine. The protocol is straightforward. All the training did come from your company. Where I see the issue is, as he mentioned, the patient the day of.
Right.
So having the capability or the staff being able to provide that service, or have the institution on board to do so, in which case there's a lot of logistic questions as to where the equipment's going to be stored, who's going to be trained for it, who's going to compensate people for providing that service.
Right, but it's been fairly simple. It's a short treatment, right?
Yes, yeah, in a matter of minutes. Right.
Okay, so I'm going to wrap up with my final question is, and I'll pose it to Dr. Kolenda first. When you're talking to your colleagues across the country, across the globe, and you're giving them advice on how to get over this hump that we're all in right now, and be able to adjust to the new norm. What advice are you giving your colleagues to help them move forward, to help ease the patient concern that is out there that you've expressed earlier?
I think the first thing you need to know is you need to understand the disease and how the disease process works. So educate yourself so you can implement the right means going forward. It is the new normal, but your patients are relying on your knowledge base to educate them as to what changes are pertinent in terms of their care going forward. Also, you use social media quite a bit to educate as well. And it's quite incredible how much misinformation is there. And we're trying to be a voice of reason and educate patients as to, again, what is this disease and how do you have to protect yourself? So I think those are really key elements. And moving forward, I mean, infections have been around with us, for eons, and we've adapted. I think that given the economic fallout, and there's a much greater awareness of how infections can impact your life. And so moving forward, we're going to continue to do what's necessary, what public health is telling us to do, which is social distancing, washing our hands. And again, we will get over COVID-19, but the issue of microbial resistance is still going to be with us. And moving forward, photodisinfection becomes a key part of managing that issue. So, that's sort of the approach that we're taking right now.
Wonderful, thank you. Dr. Marion.
Yes, as you mentioned, the new norm, COVID-19 will likely pass, but not anytime soon. We really have to think long-term. And once again, not just about COVID-19, but as previously mentioned, the drug-resistant bacteria. And I really see the challenge is going to be mitigating risk. Everything that we're already doing in terms of a multidisciplinary approach and physical distancing. But if this product helps us mitigate that risk, that's an important concept. Reason being is what we don't want to do is get into a scenario where we're not providing the care patients need because of fear of COVID. The fact of the matter is they're going to have continued issues with respect to multiple comorbidities and potentially be postponing them out of fear.
Right. And that would be worse, right, than the waiting time that we have here.
Mm-hmm.
All right. Well, thank you. If you have any questions for everyone on the call, please submit them via the Q&A. I have one question. Are you administering this on yourself? Have you taken the treatment yourself? Dr. Marion.
Yes, I have. So as mentioned, when we were uncertain as to the community spread and the numbers here in Thunder Bay with respect to COVID-19, while I was on call, I administered it to myself anytime I felt that I was at risk of exposure. Any
comments about the procedure? Was it everything you
simple,
thought it was? Or?
Yeah, it's simple, it's fast. There's no discomfort associated with it. It's pretty straightforward.
Thank you. Dr. Kolenda.
So I'm not administering it myself because I actually invested in an antibody testing kit that I was able to get through friends from Korea, and I actually tested positive. So I know I have, immunity to it. But all my staff have twice weekly treatments, and we feel that way, if at any point during the week they're able, or if they come into contact with somebody with COVID, then we can actually provide that treatment to them. And it's amazing how it's changed their ability to cope with this. Before there was a lot of fear, right. And now they feel that they have a tool that they can rely on, a treatment, so to speak, that keeps them safe. And I can tell you, once, in terms of my testing, once I had it, it changes how you behave.
Right.
It totally does. So I think what we're waiting for is the antibody testing, the PCR testing that need to be combined. And I think that will change the attitudes and what we're seeing across. But up to now, if you don't have it, for my staff, it served as a great purpose to give them the safety that they're looking for. Wonderful.
Thank you. I don't have any more questions. Anybody else? I'll just give it a minute. So I really want to thank both of you for your time and obviously your support and of the product and usage in your practice, and also for being willing to tell other people how you're using it and how successful it's been for you. So we really want to thank you for your time here tonight. So I am going to say goodbye to both you gentlemen and wish you a great day. And we will talk soon. And then I'm going to introduce our next speaker, which will be Jason Hickok.
Thank you very much.
Thank you.
Thank you.
Take care. Bye.
Bye-bye. So Jason's our VP of Medical and Clinical Affairs. He spent 15 years leading infection control for the Hospital Corp of America, also known as HCA, and implemented nasal decolonization for 180 hospitals that he oversaw. Jason is co-author on several large-scale nasal decolonization studies, and we're happy to have him at Ondim. He will briefly describe our technology platform as well as our nasal decolonization technology, which is Health Canada approved and has received fast track designation for the US FDA. Jason, I'm going to hand it over to you because I know you have some slides to share. So I am going to step off video for a few minutes here and hand it over to you.
All right, thanks, Michelle, and welcome everyone. I'm going to spend the next few minutes talking a little bit about our technology, how it works, and some of the clinical trials that we have ongoing, both with COVID and some of the more exciting clinical trials that we have coming up in the US. So I have a couple of slides I want to share with you just to illustrate how the technology works. Okay, so how does photodynamic therapy work? So photodynamic therapy is the combination of a light-sensitive drug and a specific wavelength of light. In our case, the active ingredient in our formulation is methylene blue, and it is activated with a specific wavelength of red light. It's around 670 nanometers. So the way the combination of these two technologies work, the formulation is applied, and in the case of nasal decolonization, it is applied inside the nares, the anterior nares. And what that does is the formulation has a positive charge. Most of the microbes that we are trying to destroy have a negative charge. So they are electrostatically attracted to one another. And our formulation coats the microbes, whether it's bacteria, viruses, or fungus. And then when the light is applied, a series of chemical reactions occur. The ones that are destructive to the microbes, of course, are the reactive oxygen species that are created, producing singlet oxygen, peroxides, things of that nature. And it literally breaks down the cell wall, channels holes in the bacteria and causing lysis of the bacteria. For viruses, it works in a very similar fashion. Again, the formulation coats the outside of the virus, and it is, once the light is applied, it's effective against the viral membrane, as well as the capsid proteins and the anionic GC base pairs of the nucleic acids, creating cross linkages and breaking the virus literally apart. It is effective against both enveloped and non-enveloped viruses, and we do have a publication, actually a couple of publications that have surfaced in the last few weeks showing that photodynamic therapy is actually effective against COVID-19. To that point, we have partnered with 3 university hospitals across Canada, and we are actively in clinical trials wanting to demonstrate that our technology itself is also effective against COVID. However, I can tell you with quite a bit of assurance that the papers that we've looked at so far, that the platform of photodynamic therapy is effective against this particular virus as well as others. And that's one of the nice things about this platform is it is non-specific. So it is not targeted towards staph or MRSA necessarily. It's effective against all microbes, viruses, and fungi included. So one of the other questions we get quite often is, well, what's involved in treatment? And here in the, on the left-hand side, you see a picture of our, I'm sorry. you see a picture of our light illuminator. That's the green device. On the end of that device, there are two nasal cones, one for the right nostril, one for the left. And that's how the light is shined inside the nose. The other component for application of treatment is the application of the drug or the formulation itself. And as you can see, it's on a swab stick. The swab is saturated with our formulation, and as you can see, it's bright blue because of the active ingredient, again, being methylene blue. In the middle, you see our light device or our laser. It's a very simple device with only 3 buttons, easily cleaned between patients. There's a play button or a start button, a stop button, and an on and off switch. So lots of human factors. Engineering went into the design of this to make it very simple and easy to use. And then some of the additional supplies that you may want to use, we always encourage the patients to clean their nose prior to treatment. You can offer glasses that actually block the red light. It is a class 1 laser, so it's not required. But for comfort of the patient, they may want to wear some type of eye protection. And then gloves, because the methylene blue will stain clothing. However, it does not actually stain the skin. The next thing I want to show you is what application looks like. So if you look at the bottom right-hand pictures, you see the formulation applicator inside the anterior nair of this patient. You can see it's form-fitting. That's rolled around and twisted inside the nair to completely coat all of the microbes that are in the anterior nair. A fresh swab would then be opened, and the other nair for the patient would be swabbed. After that, which takes about 30 to 40 seconds, then you have application of the light illuminator. Again, this is connected to the light source, and the device is programmed to shine the light for 2 minutes. And it's only during that 2 minutes that this reaction is active. So the methylene blue or the formulation alone is not effective against microbes. The light alone is not effective. Once the light starts, the reaction begins. When the light is turned off, the reaction stops. It's a very safe and effective procedure. I can tell you that it has been used on over 60,000 Canadians with no serious adverse events reported during that time. It's been in use for about 10 years at Vancouver General Hospital, and we have other sites that I've also adopted. One last thing that I'd like to show you, people like to see what publications that we have. I'll start here with the Vancouver General Hospital publication. This came out in 2014 in the Journal of Hospital Infection. This was our original study. I had a little over 3,000 patients undergoing elective surgeries. And what it showed was that they saw within the first year a 42% reduction in surgical site infections. I was involved in a very similar study in the US, which I'm co-author on, and we saw a very similar reduction, around 43% in post-op surgical site infections when nasal decolonization was added preoperatively. The next slide that I want to show you is that in addition to the Vancouver General study, Dr. John Street, who is a spine surgeon at Vancouver General, also published and saw over a 10-year period a 78% reduction in surgical site infections among spine patients. So one of the most interesting things I think out of the study is you see here only 18 patients needed to treat to prevent one infection, and on average you saw 53 fewer infections per year and a significant cost savings. To demonstrate what Dr. John Street saw, you can see over a period of 10 years, he implemented a variety of different interventions. and where he saw the greatest reduction from around 7% down to 2% was when he added our photodisinfection technology as well as skin decolonization. And that led to the dramatic reduction. I'll finish here by saying that the study that I showed you originally, the Vancouver General Hospital study, they were able to drop their absolute infection rate from 2.7 to 1.6%, which is a 42% reduction. We often get the question of what has happened since that first quality improvement initiative. And I'm happy to say that their infection rates are far below 1% for a total of over an 80% reduction in their surgical site infection rates. So with that, I'm going to pause. And Michelle, if there are any questions.
There is a question, and I'm going to come back on video for that. So the question we received was, what does this cost? And so Jason had showed you that there is a laser and that there are consumables. We have, per treatment, you're getting 4 popules, one of the light illuminators, which are disposable. So one-time use for the light illuminator and for the 4 popules, which is considered one treatment, and then you have a laser. We have a variety of ways to work with facilities in order to provide this technology and these treatments that would work for you. We have rental options, as well as we have the ability to buy the equipment outright. So I ask you to work with your sales team and to really understand what it means for you. We're averaging anywhere between $75 to $100 per treatment, depending upon your volume. So at least gives you a framework to understand what this could possibly fit in your organization. As well as, you know, when you listen to Dr. Kolenda, he has been very successful in selling the treatment. He knows his patients are already paying for some kind of antibiotic, and this is an alternative to that particular protocol. So was there any other questions that are coming through on the chat line for Jason? Jason, do you have any more on yours? Nothing?
Sorry, no, not at this time.
All right, if there's no questions, we want to thank you. So obviously you've done such a thorough job, Jason. Nobody has any questions. But we're here. If you do have any questions, we will be sending out a post-webinar survey, as well as reposting this webinar on our website, as well as social media. So thank you again for your time, and we appreciate your attendance today. Have a great day.